Hey everyone, welcome to the first episode ever of Bringing Virtual Care Home. Today I'm just acting as a guest host, and I'm introducing you to your main host, Tina Null, the Chief Clinical Officer at Anelto. So let's welcome Tina. Tina, so excited to have you hosting this show. I'm just filling in so the audience can get to know you a little bit.
Thank you. Nice to be here.
Why don't we start out by you telling the audience a little bit about your background, and then we'll talk about Anelto and then what this show is all about.
Sure, I'd be happy to. So I have been a nurse for 38 years and spent 27 of those years in a leadership position. All but the last 3 years, I've been working for two different integrated health systems in Central Ohio, and started my career in the clinical area of OB and spent 13 years in that area before moving into a project management position for healthcare as a certified change management practitioner, and then as a Six Sigma black belt with a lean manufacturing certification. From there, I went to be a director of health information management and patient access at one of the hospitals within the health system where I was working. And after 5 years of doing that and bringing that hospital from a paper medical record to an electronic medical record, I transferred back into the nursing realm as a director of nursing, and did that particular position over two hospitals for a health system, managing all levels of acute care as well as clinical education, nursing supervision, and respiratory care. And then from there, I made a move into the home care world in the same health system as a system director over the business line of hospice. And from there, I had my first exposure to remote patient monitoring and became a customer of a remote patient monitoring solution. And then later went to work for that company in the role of a clinical consultant, supporting national accounts that vendor had in the remote patient monitoring space. And from there, I joined Anelto as the Chief Clinical Officer this past April.
Super exciting career journey so far. And then now you get to add host of a podcast to it all as well, which is exciting.
I do.
Can you give us a little bit additional overview of Anelto?
Sure. So Anelto has been around for about 12 years, and they started as a company that created and sold PERS devices. That's an acronym. PERS stands for Personal Emergency Response System. And they have about 270 to 300,000 of those units active across the United States at this point in time. They would sell those devices to distributors, or they have sold those devices to distributors, and are still producing that device, but at the same time decided that they wanted to get into the remote patient monitoring space and build out a comprehensive solution to allow that type of care to be sold to all kinds of health systems, providers, clinics, payers, etc., to begin to bridge the gap in care between acute care and scheduled physician office visits for those patients that are at high risk for readmissions and unnecessary ED visits.
Now, what's some of the excitement for you on your end for having this podcast?
Yeah, so some of the excitement for me is the ability to talk to thought leaders that I'm hoping are as passionate about remote patient monitoring and decreasing the cost of healthcare by moving it away from the acute care world as the front door to healthcare, and helping to improve the quality of life of people who are either dealing with chronic disease or are, again, a high-risk population that without daily surveillance may tend to have to go into an emergency department or a hospital admission that could otherwise be avoided.
Really interesting. And I know we have some great guests that are going to be lined up for your show. You'll have some great conversations. So everyone will be able to check out some panels that you'll have, also some one-on-one talks. And we have some really creative stuff planned, which is going to be fun. What what is, I guess, what type of conversations are you most excited having, or is it a mix? Are you excited for the one-on-ones? Are you excited for the panels? What is your excitement around like the different types of talks that we're going to have?
Yeah, the panel discussions will excite me from a standpoint of bringing multiple perspectives together around a topic that I'm hoping all panelists feel passionate about. And the individual conversations are a way for me to, again, learn what is motivating, inspiring, and leading the healthcare realm at this point in time, as everybody is trying to transition to more of a value-based proposition, and again, conquer the quadruple aim of healthcare of being able to provide it at the lowest cost in the best place, satisfying both patients and providers.
Love it. Well, I'm excited for this show to get kicked off. If anyone is interested in being a guest for this show outside of who we reach out to, there is a link on our website where they can request a guest and then select your show. So they'll have that. But really excited to see this show kind of fully bloom and for you to be the host and to have some amazing guests on. So good luck to you.
Thank you. I look forward to it.